If you've had ACL surgery and your knee won't fully straighten, then this video is for you. You might be stuck at 5 or 10 degrees, which doesn't sound like a lot, but that last little bit is really important. And here's the truth. If you don't get that last little bit of extension back, it can ruin your entire recovery. I see it all the time. People can bend their knee okay, they're working really hard, they're doing all their exercises, but they can't quite look out their leg fully, and it's frustrating. So why does this happen? Let's break it down and what you need to do about it. If you want something to help you measure the movement you've got in your knee after surgery, I've built a free app that you can use. It's called Knee Ramp. It uses your smartphone to measure the movement you've got in your knee in both extension and flexion. And I've put a link to it in the description to this video down below. So go and use it. It plots your range of movement in a graph so you can see your mobility improving over time. So why is it so hard to fully extend your knee after ACL surgery? First, swelling. There's a lot going on inside your knee joint. And if you throw a load of fluid in there, it just gets in the way of your knee fully extending because there's essentially a bubble of fluid in the middle getting in the way. And until that reduces, you might feel like you're just pushing against the wall. Secondly, pain and muscle guarding. Your body's clever. After surgery, it protects your knee joint by tightening the muscles around it, and that reflex contraction prevents you from straightening it fully. Third, scar tissue, one you might have heard quite a lot about. Your body lays down scar tissue as part of the healing process. That's completely normal, and that tissue can become excessive or stiff, and it can mechanically limit extension. Fourth, the graft itself. Straight after surgery, the graft's at its tightest. Over time it'll adapt and loosen, but early on it can feel and be restrictive. And finally, arguably the most important, is fear, which is underrated. Sometimes there's no physical block. You're just subconsciously avoiding it because that fully straightened leg makes it feel vulnerable. And that's completely understandable. So why is full extension a non-negotiable? And let's be straight, it's not optional. If your knee doesn't straighten fully, you can't walk normally, your gait becomes asymmetrical, you overload other joints and lead to compensation, your exercises don't progress properly, and long-term outcomes suffer. Loss of full extension is one of the most common complications after ACL surgery. And here's the key. It's much easier to regain extension early than it is to fix it later down the line. So to do it, what should you be doing? Extension should be your priority from day one. Not flexion, extension. And here's what I recommend to my patients and people on my program. Prone hangs. So lie on your front with your leg hanging off the bed and let gravity gently pull your leg down, straightening your knee. Do this for between 5 and 15 minutes per day, multiple times a day, as much as you can tolerate. Yes, it might be a bit uncomfortable. Don't go past the 3 out of 10 pain, but a bit of discomfort's fine. And that's completely normal. Second exercise is heel prop. So lie on your back, prop your heel on a rolled towel and let the knee sag into extension. You can even put gentle pressure on your knee to just help it extend a little bit, but don't force anything. Next is quad sets. So I talk about these a lot. Actively contracting your quadricep muscle. So squeeze the thigh, push the back of the knee down, and that muscle activation helps to improve extension. Next is controlling swelling pretty aggressively using ice, compression, elevation, reduce the fluid, and you reduce the block. Finally, manual therapy. If you're seeing a physiotherapist, hands-on work can be really beneficial. It can help break down adhesions and improve knee mobility. But most importantly, don't just work on it during your physio session. You need to be working on it multiple times a day, especially in the early stages of rehab, when you're probably not working, which is also when it's most important to get the extension back. When should you be concerned? If you're not making any progress in the first few weeks, speak to your surgeon or your physio. In some cases, manipulations under anaesthetic or lysis of adhesions are required. It's not common, but ignoring your progress in terms of extension is how you end up there. If you take one thing from this video, it's this. Full extension is non-negotiable. Make it your daily priority from day one. Before flexion, before strength, definitely before any fancy gym exercises that you've seen on TikTok. Get your knee straight, everything else builds from there. If you want to hear more about how your flexion should improve, which is how much you can bend your knee over time, then watch this video and I'll see you in the next one.